Yes.
David Johnson from Stockport. This is the last paper on the inequalities. Is the lower social deprivation index an index of other comorbidities, making those patients less likely to be fit to have a replacement, which may explain why they didn't have a replacement? If you look at the ASA grading, which is within their JR.
Thank you for this question. So at the moment, today I'm only presenting on the provisions and I cannot yet discuss on the outcomes. So please stay tuned and I will answer this one in a couple of months.
It is a very important question that David raises because it's about fitness, but the other issue, of course, is do patients actually present to their general practitioner for referral, because there's a big educational component here in the community. It's not necessarily just the health services responsibility, it's also the individuals to present themselves with their health. Other questions? We might finish quiet. We might finish on time if we don't have any further questions. Okay, so
Mark, I'll ask one.
Go on then.
Hello, I'm Paul Cohen, Chair of the NGR, and again it's about health inequalities. You mentioned about continuing inequalities. The recent paper by Mike and his team at Bristol showed the swing towards more people having operations set up in the independent sector. And given that private hospitals tend not to be built in the most economic areas, would you expect that the inequalities would be increasing over time and not so?
That's a very, very good question that only time will help us to address. But in this particular research, we investigate the procedure performed in the public and private sectors. And for the e-provisions, we found difference in both areas. And then I don't know whether because you have three models. You have the procedure performed in the NHS, the procedure performed in the private sector but funded by the NHS, and the procedure performed by the private sectors and funded by the patients. And here, that's my view, but I imagine that not all patients are routed toward the private sectors because only the fittest patients will go in the private sector, and therefore the inequality may be stronger in the public sector. That's something we need to monitor further.
Yes, so extracting the patients who are NHS funded who go into the private sector could be an interesting next step. Okay, thank you.
Andy,
Tim, I think an important thing in this inequalities world is I think we see a new inequality coming through, which is to do with the comorbidity you have. So what you don't want it to be is in this expansion of the solution for hip and knee replacement, which has been in NHS independent sector. Remember, before COVID, there were 10 years of expansion of hip and knee replacement. Virtually all of it was in the independent sector, and now that's worse. If you're ASA grade 3, they don't want to do it. And so they are a disenfranchised group of people. And if you're in the wrong place, accessing care, I think it's going to become, you'll see very much this sort of layers of inequality, which are not just about geography, which are going to be to do with your accountability.
So, go on then. I was going to take Chair's prerogative for the last question, but I'm going to give it to Jonathan now instead.
I was just going to go on, it's more of a continuation of exactly the point there, is that it's not just the provision within the independent sector. We're seeing a lot more of the high volume, low complexity hubs that might not have the capacity to take on the high ASAs as well, so I think that problem will become even worse in the post-COVID recovery. But what we've also seen with the trends as we're doing the annual report is that this gap of more cases being done in the independent sector is getting bigger. Eric's paper only went up to 2017, which is obviously pre-COVID, and I think if we were to redo it again, now you see that the provision of both NHS paid and independent pay in the independent sector is bigger and wider, and we probably see even more inequalities. Just to exactly highlight our chairman's work.